Welcome to NCLEX Made Easy 91. Today, we're diving into 50 of the toughest NCLEX drug questions, covering respiratory medications, antiarrhythmics, antihypertensives, CHF treatments, vasopressors, and GI drugs. These questions are carefully crafted with rationales and strategies to not just test you, but to teach you. If you've ever struggled to remember which drug is contraindicated in asthma, which improves CHF survival, or which causes drug-induced lupus, this video is for you. Grab your notebook, pause after each question, and challenge yourself. This is the kind of high-level practice that will boost your confidence and get you exam ready. Question 1. Which drug is contraindicated in acute severe asthma attack? A. Salbutamol. B. Terbutaline. C. Cromolyn sodium. D. Ipratropium bromide. Answer: C. Cromolyn sodium. Rationale: cromolyn is a mast cell stabilizer used for long-term prophylaxis. It prevents mediator release over time but does not produce rapid bronchodilation. Acute bronchospasm requires agents that act within minutes, e.g., short-acting beta-2 agonists or inhaled anticholinergics. Strategy: acute equals pick fastest-acting rescue medication. Question 2. A patient taking theophylline has a serum level of 25 micrograms per milliliter. What is the nurse's best action? A. Hold the dose and notify provider. B. Administer as prescribed. C. Give activated charcoal immediately. D. Repeat drug level in 24 hours. Answer: A. Hold the dose and notify provider. Rationale: theophylline has a narrow therapeutic range, 10 to 20 mcg/ml. Levels greater than 20 micrograms per milliliter increase risk of seizures and ventricular arrhythmias. Immediate step is to stop dosing and consult provider for toxicity measures. Strategy: for narrow therapeutic drugs, hold and call if level is above range. Question 3. Which of the following is not a leukotriene receptor antagonist? A. Montelukast. B. Zafirlukast. C. Zilutin. D. Dextromethorphan. Answer: D. Dextromethorphan. Rationale: Montelukast and Zafirlukast block leukotriene receptors, Zilutin inhibits leukotriene synthesis. Dextromethorphan is an antitussive acting centrally, unrelated to leukotriene pathways. Strategy: identify drug classes, spot the odd mechanism. Question 4. Long-term oral prednisone therapy increases risk of all except A. Osteoporosis. B. Hyperglycemia. C. Immunosuppression. D. Hyperkalemia. Answer: D. Hyperkalemia. Rationale: systemic corticosteroids cause sodium retention and potassium loss, hypokalemia, raise blood glucose, suppress immune function, and decrease bone density. Hyperkalemia is not typical. Strategy: remember steroid adverse effects, hyperglycemia, immunosuppression, osteoporosis. Question 5. Which drug is most appropriate for acute anaphylaxis? A. Epinephrine. B. Diphenhydramine. C. Hydrocortisone. D. Salmeterol. Answer: A. Epinephrine. Rationale: epinephrine rapidly reverses bronchospasm and hypotension via alpha and beta agonism. Antihistamines and steroids are adjuncts that act more slowly and do not replace epinephrine in the acute setting. Strategy: anaphylaxis plus airway/BP compromise equals epinephrine immediately. Question 6. Amiodarone toxicity can cause all except A. Pulmonary fibrosis. B. Thyroid dysfunction. C. Blue-gray skin discoloration. D. Hypoglycemia. Answer: D. Hypoglycemia. Rationale: amiodarone contains iodine and accumulates in tissues. It commonly causes thyroid dysfunction, hyper or hypothyroid, pulmonary fibrosis, and skin discoloration. It does not classically cause hypoglycemia. Strategy: monitor lungs and thyroid when patient is on long-term amiodarone. Question 7. Which drug is given to terminate supraventricular tachycardia? A. Adenosine. B. Verapamil. C. Lidocaine. D. Procainamide. Answer: A. Adenosine. Rationale: adenosine causes a very short-lived AV nodal block, often terminating paroxysmal SVT. It has an ultra-short half-life, less than 10 seconds, and produces transient flushing or chest pressure. Strategy: for acute SVT with narrow QRS, think adenosine first. Question 8. Which drug is contraindicated in Wolff-Parkinson-White (WPW) syndrome? A. Procainamide. B. Amiodarone. C. Digoxin. D. Ibutylide. Answer: C. Digoxin. Rationale: in WPW, digoxin may increase conduction over accessory pathways, worsening ventricular response and potentially precipitating ventricular fibrillation. Procainamide is often preferred. Strategy: no WPW-specific contraindications, avoid AV nodal agents that favor accessory pathway conduction. Question 9. A patient on lidocaine infusion becomes confused and reports paresthesia. What should the nurse do first? A. Stop infusion. B. Give atropine. C. Increase infusion. D. Notify respiratory therapy. Answer: A. Stop infusion. Rationale: CNS changes, confusion, paresthesias, tremor, are early manifestations of lidocaine toxicity. Immediate cessation prevents progression to seizures or cardiovascular collapse. Strategy: in suspected drug toxicity, stop medication first, then notify provider. Question 10. Which of these is not a Class 3 antiarrhythmic? A. Amiodarone. B. Sotalol. C. Ibutylide. D. Furosemide. Answer: D. Furosemide. Rationale: Class 3 agents predominantly block potassium channels and prolong repolarization. Furosemide is a loop diuretic unrelated to antiarrhythmic classes. Strategy: use von Williams classification to categorize options quickly. Question 11. A patient on lisinopril develops a persistent cough. The provider is likely to switch the patient to A. Losartan. B. Verapamil. C. Hydralazine. D. Minoxidil. Answer: A. Losartan. Rationale: the dry cough from ACE inhibitors is due to increased bradykinin. ARBs, e.g., losartan, provide similar BP control without significant bradykinin accumulation, reducing cough incidence. Strategy: ACE inhibitor cough, pick an ARB as the alternative. Question 12. Which of these drugs is not typically used in hypertensive emergency? A. Labetalol, 4. B. Nitroprusside, 4. C. Hydralazine, 4. D. Lorazepam. Answer: D. Lorazepam. Rationale: hypertensive emergencies require rapid-acting 4 antihypertensives to reduce target organ damage. Lorazepam is an anxiolytic and does not lower BP reliably in this context. Strategy: for emergency choose fast-acting 4 BP drugs. Question 13. When initiating prazosin for hypertension, the best patient teaching is A. Take first dose at bedtime. B. Expect significant tachycardia immediately. C. Avoid potassium-rich foods. D. Do not drink water with dose. Answer: A. Take first dose at bedtime. Rationale: alpha-1 blockers cause profound first-dose hypotension and syncope, giving at night minimizes fall risk. Reflex tachycardia can occur but is managed clinically. Strategy: always consider first-dose effects for alpha blockers. Question 14. At low infusion rates, dopamine predominantly causes A. Renal vasodilation. B. Systemic vasoconstriction. C. Bradycardia. D. Bronchodilation. Answer: A. Renal vasodilation. Rationale: dopamine's effects are dose-dependent. Low, dopaminergic doses increase renal blood flow, moderate doses increase cardiac contractility, beta-1, high doses cause alpha-mediated vasoconstriction. Strategy: remember dose response, low equals renal, moderate equals inotropy, high equals vasopressor. Question 15. Which is not a typical adverse effect of beta blockers? A. Bradycardia. B. Bronchospasm. C. Hypotension. D. Hyperkalemia. Answer: D. Hyperkalemia. Rationale: beta blockers commonly cause bradycardia, hypotension, and in non-selective types can cause bronchospasm. They are not known for causing hyperkalemia. Strategy: identify physiologic effects of beta-1 versus beta-2 blockade. Question 16. What is often the earliest symptom of digoxin toxicity? A. Visual halos. B. Arrhythmia. C. Nausea/vomiting. D. Confusion. Answer: C. Nausea/vomiting. Rationale: GI symptoms, anorexia, nausea, vomiting, commonly precede neurologic or cardiac toxicity. Hypokalemia increases digoxin toxicity risk. Early recognition and K monitoring are critical. Strategy: in toxicity questions, tie GI signs back to common drug toxicities, digoxin GI first. Question 17. Which medication has been shown to improve mortality in CHF? A. Digoxin. B. Furosemide. C. Carvedilol. D. Milrinone. Answer: C. Carvedilol. Rationale: beta blockers, carvedilol, metoprolol, bisoprolol, ACE inhibitors/ARBs, and mineralocorticoid receptor antagonists improve survival. Digoxin improves symptoms but not mortality. Milrinone improves hemodynamics but not long-term survival. Strategy: for improved survival, choose agents supported by outcome trials, ACEI/ARB, BB, spironolactone. Question 18. Which adverse effect is most associated with spironolactone? A. Hyperkalemia and gynecomastia. B. Hypokalemia and ototoxicity. C. Hypercalcemia and renal stones. D. Pulmonary fibrosis. Answer: A. Hyperkalemia and gynecomastia. Rationale: spironolactone is a potassium-sparing diuretic and an androgen receptor antagonist. It causes K retention and can lead to gynecomastia in men. Strategy: monitor potassium and counsel on endocrine side effects. Question 19. Which drug must not be combined with phosphodiesterase 5 inhibitors, e.g., sildenafil? A. Digoxin. B. Furosemide. C. Nitroglycerin. D. Hydralazine. Answer: C. Nitroglycerin. Rationale: concurrent nitrates and PDE5 inhibitors can cause profound vasodilation and life-threatening hypotension. Always assess for ED medications before giving nitrates. Strategy: in drug interaction questions, recall major dangerous combos, nitrate plus PDE5 inhibitor. Question 20. Loop diuretics commonly cause all except A. Hypokalemia. B. Ototoxicity, high doses. C. Hyperuricemia. D. Hypercalcemia. Answer: D. Hypercalcemia. Rationale: loops inhibit NaK2Cl in thick ascending limb and promote calcium excretion, potentially causing hypocalcemia. Hypercalcemia is not typical. Ototoxicity can occur with high 4 doses. Strategy: loops lose Ca superscript 2, thiazides retain Ca superscript 2. Question 21. Which medication irreversibly inhibits the gastric H/K ATPase pump? A. Ranitidine. B. Pantoprazole. C. Sucralfate. D. Misoprostol. Answer: B. Pantoprazole. Rationale: proton pump inhibitors, PPIs, such as pantoprazole covalently inactivate the proton pump, leading to prolonged acid suppression. H2 blockers, ranitidine, are reversible H2 antagonists. Strategy: associate PPIs with irreversible pump inhibition and timing, take before meals. Question 22. Lactulose treats hepatic encephalopathy primarily by A. increasing ammonia absorption. B. acidifying the colon to convert NH3 to NH4. C. stimulating bile flow. D. neutralizing gastric acid. Answer: B. acidifying the colon to convert NH3 to NH4. Rationale: lactulose is metabolized by gut bacteria to acids, lowering pH, ammonia, NH3, is protonated to ammonium, NH4, which is less absorbable and excreted. This reduces blood ammonia and improves encephalopathy. Strategy: link treatment mechanism to ammonia handling in hepatic failure. Question 23. Which patient should not receive metoclopramide? A. GERD patient with severe reflux. B. Diabetic gastroparesis. C. Patient with Parkinson's disease. D. Cancer patient with chemo-induced nausea. Answer: C. Patient with Parkinson's disease. Rationale: metoclopramide is a dopamine antagonist and can exacerbate extrapyramidal symptoms in patients with Parkinson's. It also carries risk of tardive dyskinesia with chronic use. Use alternative antiemetics in these patients. Strategy: avoid dopamine antagonists in Parkinson's, check neurologic history. Question 24. Misoprostol is contraindicated in which group? A. Women of childbearing potential without reliable contraception. B. Patients on chronic NSAIDs who need ulcer protection. C. Patients with GERD seeking mucosal protection. D. Patients with Zollinger-Ellison syndrome. Answer: A. Women of childbearing potential without reliable contraception. Rationale: misoprostol causes uterine contractions and can induce abortion. It's contraindicated in pregnancy and must be used cautiously in women of childbearing age. Strategy: always ask pregnancy status before prescribing uterotonic or abortifacient agents. Question 25. Which effect is commonly seen with bismuth subsalicylate, Pepto-Bismol? A. Blue urine. B. Black stool/tongue. C. Red discoloration of tears. D. Orange urine. Answer: B. Black stool/tongue. Rationale: bismuth interacts with sulfur to form bismuth sulfide, causing harmless black discoloration of stool and tongue. Educate patients to avoid mistaking it for melena. Strategy: distinguish harmless medication effects from pathologic signs, melena. Question 26. Which of the following is not used for motion sickness? A. Dimenhydrinate. B. Meclizine. C. Scopolamine. D. Metformin. Answer: D. Metformin. Rationale: dimenhydrinate, meclizine, and scopolamine act on vestibular pathways to reduce motion sickness. Metformin is an antidiabetic agent unrelated to vestibular control. Strategy: group by therapeutic purpose, pick the one out of class. Question 27. Ondansetron exerts antiemetic effects primarily by blocking which receptor? A. Histamine H1. B. Serotonin 5-HT3. C. Dopamine D2. D. Muscarinic M3. Answer: B. Serotonin 5-HT3. Rationale: ondansetron is a selective 5-HT3 receptor antagonist effective for chemo-induced and postoperative nausea and vomiting, and it acts both centrally and peripherally. Strategy: place ondansetron with serotonin antagonists, not dopamine antagonists. Question 28. Sucralfate is best administered. A. With meals. B. Immediately after meals. C. 30 minutes before meals. D. Along with antacids. Answer: C. 30 minutes before meals. Rationale: sucralfate requires an acidic environment to form a protective barrier over ulcers. Giving it before meals maximizes mucosal protection. Antacids can interfere with its action. Strategy: pay attention to timing instructions, they're often testable. Question 29. Which of the following drugs can cause gingival hyperplasia? A. Phenytoin. B. Nifedipine. C. Cyclosporin. D. All of the above. Answer: D. All of the above. Rationale: phenytoin, anticonvulsant, certain calcium channel blockers, nifedipine, and immunosuppressants, cyclosporin, are all associated with gingival overgrowth. Dental hygiene and dose adjustments can mitigate risk. Strategy: remember clusters of drugs that share unexpected adverse effects. Question 30. Which commonly used antiemetic has been linked to QT prolongation? A. Ondansetron. B. Metoclopramide. C. Prochlorperazine. D. Lorazepam. Answer: A. Ondansetron. Rationale: Ondansetron, especially for and in high doses or with other QT prolonging drugs, may prolong the QT interval and predispose to torsades de pointes. Use caution with cardiac patients. Strategy: in patients with cardiac risk, check ECG and medication interactions before choosing antiemetics. Question 31. Which beta blocker is considered cardioselective, beta-selective? A. Atenolol. B. Propranolol. C. Nadolol. D. Timolol. Answer: A. Atenolol. Rationale: atenolol preferentially targets beta receptors in the heart, reducing heart rate and contractility, and is less likely to provoke bronchospasm than non-selective agents like propranolol. However, at high doses selectivity is lost. Strategy: for patients with reactive airway disease, prefer beta-selective agents. Question 32. Which calcium channel blocker is NO-N-dihydropyridine and primarily affects cardiac conduction? A. Amlodipine. B. Nifedipine. C. Verapamil. D. Felodipine. Answer: C. Verapamil. Rationale: verapamil and diltiazem are non-dihydropyridines that slow AV nodal conduction and decrease heart rate, used for arrhythmias and rate control. Dihydropyridines primarily cause vasodilation. Strategy: categorize CCBs, non-dihydropyridines equals cardiac effects, dihydropyridines equals vascular. Question 33. Hydralazine therapy commonly causes which compensatory response? A. Reflex tachycardia. B. Hyperkalemia. C. Hypoglycemia. D. Gout. Answer: A. Reflex tachycardia. Rationale: hydralazine induces arteriolar vasodilation that lowers BP, prompting reflex sympathetic activation and tachycardia. Clinicians may combine with beta blocker to blunt this effect. Strategy: anticipate reflex physiologic responses and plan combination therapies. Question 34. Antihypertensive drug of choice for many pregnant patients is A. ACE inhibitors. B. Methyldopa. C. ARBs. D. Nitroprusside. Answer: B. Methyldopa. Rationale: methyldopa has a long history of safety in pregnancy. ACE inhibitors and ARBs are teratogenic and contraindicated. Nitroprusside is generally avoided due to fetal risk. Strategy: pregnancy changes drug selection, always screen for pregnancy and pick safe agents. Question 35. Which medications are known to cause a lupus-like syndrome? A. Hydralazine. B. Procainamide. C. Isoniazid. D. All of the above. Answer: D. All of the above. Rationale: hydralazine, procainamide, and isoniazid are classic causes of drug-induced lupus. Symptoms include arthralgias, fever, serositis, and positive ANA that typically resolve after stopping the drug. Strategy: for unexplained lupus-like complaints, review medication history for these agents. Question 36. Drug of choice for acute pulmonary edema, to rapidly reduce preload, is A. Furosemide. B. Spironolactone. C. Hydrochlorothiazide. D. Mannitol. Answer: A. Furosemide. Rationale: for loop diuretic produces rapid diuresis, reducing pulmonary congestion and preload. Adjuncts include oxygen, nitrates, and morphine in selected cases. Spironolactone acts slowly and is not for acute relief. Strategy: acute cardiogenic pulmonary edema, pick fast-acting diuresis, for loop. Question 37. Which of these is not a vasopressor used to raise systemic vascular resistance? A. Dopamine, high dose. B. Epinephrine. C. Norepinephrine. D. Lorazepam. Answer: D. Lorazepam. Rationale: lorazepam is a benzodiazepine sedative and does not have vasopressor properties. Dopamine, API, and norepi are commonly used vasopressors depending on receptor targets. Strategy: distinguish between pressors and sedatives, they produce opposite hemodynamic effects. Question 38. Which drug is specifically used to relieve opioid-induced constipation without reversing analgesia? A. Loperamide. B. Methyl naltrexone. C. Diphenoxylate. D. Atropine. Answer: B. Methyl naltrexone. Rationale: methyl naltrexone is a peripherally acting mu-opioid receptor antagonist that alleviates constipation but does not cross the blood-brain barrier, preserving central analgesia. Loperamide is an opioid agonist used for diarrhea. Strategy: in opioid-related side effects, look for peripheral antagonists that spare central effects. Question 39. Which antibiotic infusion is associated with red man syndrome when given rapidly? A. Vancomycin. B. Gentamicin. C. Ciprofloxacin. D. Azithromycin. Answer: A. Vancomycin. Rationale: rapid infusion of vancomycin can cause histamine-mediated flushing, red man syndrome, slowing infusion rate and giving antihistamines prevent it. This reaction is not true allergy in many cases. Strategy: for red man syndrome, slow infusion and consider premedication. Question 40. Antidote for benzodiazepine overdoses. A. Flumazenil. B. Naloxone. C. Protamine. D. Atropine. Answer: A. Flumazenil. Rationale: flumazenil competitively inhibits benzodiazepine binding at GABA receptors and reverses sedation. Use with caution if chronic benzodiazepine use is present due to seizure risk. Strategy: match antidote to drug class, weigh seizure risk before use. Question 41. Which drug class directly blocks the proton pump, providing powerful, long-lasting acid suppression? A. Proton pump inhibitors, e.g., pantoprazole. B. H2 receptor antagonists, e.g., ranitidine. C. Antacids, e.g., magnesium hydroxide. D. Prokinetics, e.g., metoclopramide. Answer: A. Proton pump inhibitors, e.g., pantoprazole. Rationale: PPIs irreversibly inhibit the H/K ADPase on parietal cells, producing longer duration acid suppression than H2 blockers or antacids. Strategy: for long-term acid control or severe GERD/ulcer disease, PPIs are preferred. Question 42. Which of the following is not a typical anticholinergic side effect? A. Dry mouth. B. Urinary retention. C. Bradycardia. D. Constipation. Answer: C. Bradycardia. Rationale: anticholinergics inhibit parasympathetic tone, producing tachycardia, not bradycardia, dry mucous membranes, urinary retention, and decreased GI motility. Strategy: think dry and slow for anticholinergic adverse effects. Question 43. Which medication is an expectorant that thins respiratory secretions? A. Guaifenesin. B. Codeine. C. Dextromethorphan. D. Diphenhydramine. Answer: A. Guaifenesin. Rationale: guaifenesin reduces sputum viscosity and promotes expectoration. Codeine and dextromethorphan are cough suppressants that reduce cough reflex. Strategy: differentiate expectorants, promote cough, from antitussives, suppress cough. Question 44. Which drugs require periodic vision screening due to risk of retinal toxicity or optic neuritis? A. Hydroxychloroquine. B. Ethambutol. C. Both A and B. D. Rifampin. Answer: C. Both A and B. Rationale: hydroxychloroquine can cause retinopathy with long-term use, ethambutol can cause optic neuritis. Baseline and periodic eye exams are recommended. Strategy: for drugs with ocular toxicity, schedule baseline and follow-up ophthalmologic monitoring. Question 45. For status asthmaticus unresponsive to beta-2 agonists, which adjunct IV therapy is appropriate? A. For magnesium sulfate. B. Cromolyn. C. Monteliacast. D. Loratadine. Answer: A. For magnesium sulfate. Rationale: For magnesium causes bronchial smooth muscle relaxation and can help severe, refractory bronchospasm. It is used as an adjunct in ICU settings. Cromolyn and montelukast are for prophylaxis. Strategy: for severe refractory asthma, select 4 therapies used in emergency settings. Question 46. Which anti-tuberculosis drug commonly causes orange-red discoloration of bodily fluids? A. Rifampin. B. Isoniazid. C. Ethambutol. D. Pyrazinamide. Answer: A. Rifampin. Rationale: rifampin imparts an orange-red color to urine, sweat, and tears, a benign but important counseling point as patients may be alarmed. Strategy: educate patients about harmless but noticeable side effects to improve adherence. Question 47. Antidote for unfractionated heparin overdose is: A. Vitamin K. B. Protamine sulfate. C. Fresh frozen plasma. D. Idarucizumab. Answer: B. Protamine sulfate. Rationale: protamine is a positively charged molecule that binds negatively charged heparin to neutralize its anticoagulant effect rapidly. Vitamin K reverses warfarin but not heparin. Strategy: match anticoagulant to its reversal agent, heparin protamine, warfarin vitamin K, dabigatran idarucizumab. Question 48. Which antibiotic has a boxed warning for increased risk of tendinitis and tendon rupture, especially in elderly or with steroid use? A. Ciprofloxacin. B. Amoxicillin. C. Azithromycin. D. Doxycycline. Answer: A. Ciprofloxacin. Rationale: fluoroquinolones carry a risk of tendon damage, caution in elderly, transplant recipients, and patients on corticosteroids. Recognize this unique and serious adverse effect. Strategy: for musculoskeletal complaints after fluoroquinolone exposure, suspect tendon injury. Question 49. Which antiemetic is most associated with risk of tardive dyskinesia when used long-term? A. Metoclopramide. B. Ondansetron. C. Prochlorperazine. D. Lorazepam. Answer: A. Metoclopramide. Rationale: metoclopramide blocks central dopamine D2 receptors and can cause acute extrapyramidal symptoms and chronic tardive dyskinesia. Limit duration of therapy when possible. Strategy: be cautious with prolonged dopamine antagonist use, watch for involuntary movements. Question 50. Which drug is famously associated with gray baby syndrome when given to neonates due to immature hepatic metabolism? A. Chloramphenicol. B. Ampicillin. C. Gentamicin. D. Ceftriaxone. Answer: A. Chloramphenicol. Rationale: neonates lack glucuronidation capacity needed to clear chloramphenicol, causing accumulation and cardiovascular collapse with a gray cyanotic appearance. This historical adverse effect is a classic safety teaching point. Strategy: avoid drugs with immature metabolism pathways in neonates, check age-specific contraindications. Great job making it through all 50 tough NCLEX drug questions. Remember, it's not just about memorizing answers, but understanding why each answer is correct. Review the rationales, revisit weak areas, and keep testing yourself until you can recall them under pressure. If this video helped you, don't forget to like, subscribe, and share with your classmates. Let's help more nursing students succeed together. And drop a comment below on which drug topic you want me to cover next: pharmacology, maternity, critical care, or mental health. Until next time, keep practicing, keep believing, and let's make NCLEX success your reality.